Hello, it's Dr. Christine Arseneau, PharmD, Functional Medicine Certified Health Coach, and I wanted to talk about eating today, but not what you eat, but how you eat, and why your whole eating hygiene is important. So if you've been dealing with Lyme disease for a while, there's a good chance that you have some gut issues, and that could be absorption issues as well. And so you know the saying, you are what you eat, but it's a little bit more than that. You are what you absorb, because if you're not absorbing what you're eating, then you're not picking up those nutrients. And a lot of people with Lyme disease are deficient in multiple nutrients. A lot of people in general are actually deficient due to our diet. So I personally had really low vitamin D levels when I was dealing with Lyme disease. Your immune system needs the vitamin D to fight off the pathogens. So I was just kind of churning through my vitamin D, and that was super low. Magnesium is another big one that a lot of people are deficient in. Magnesium is involved, it's a cofactor in a lot of reactions in your body. So your body uses it for a lot of things. So some people might need to supplement in addition to eating, and so it is a good idea to check certain nutrient levels, vitamins, to see where you're at and supplement if needed. But I wanted to talk about the basics of eating today, because I know you guys are spending a lot of money on supplements and things already, and if you're not focused on the basics, then you could be wasting your money. You know, if you're buying digestive enzymes and things, but you're not doing the basics and sitting down to eat and making it an environment where your body is ready to digest and absorb, then you're kind of wasting your money on other things, or you might not need those other things. So I wanted to focus on just the basics of eating. And food, eating, digestion, it doesn't start in your mouth. It starts even before that. It starts in your thoughts. It starts when you're prepping food, cooking food. And so it all comes down to being mindful. And mindful of what you're eating, and that it's going to nourish you and be good for your body and all of your cells, and to replete all of those nutrients that you need. And so multitasking when eating, not a good idea. So I'm half German, half American, and I can tell you the American side is way worse on this. As far as eating on the go, eating in your car, multitasking, shoving food in your face while you're at meetings. It's not conducive to a good digestion. You have a parasympathetic system and a sympathetic system. So the sympathetic is the fight or flight. Parasympathetic is rest and digest. Digest, rest. We need to be in that parasympathetic state when we're eating. So that starts with sitting instead of standing. If you're eating on the go, if you're standing, your body doesn't know it's time to eat because you're up and about. So you don't want to eat until you are fully present and able to be mindful. And your thoughts are important. So thinking about the food, looking forward to it, realizing how nourishing it is, and just sitting down, making time, making a ritual for yourself. So being mindful is one of my top rules for eating, for having optimal digestion. And I have a lot of friends from India, and I know a little bit about Ayurvedic medicine, and it's interesting, like the differences in other cultures and how, they think that when you're cooking, like all of your thoughts and emotions and everything that you're feeling are going into the food. So you don't watch TV or do other things when you're cooking, because that energy would go into the food. So you want it to be full of love and nourishment. And then there's also this thing in Indian culture called Agni, which is digestion. It's like the fire in your belly, the digestion. And so digestion is this thermodynamic process, and it's all about heat. And so when you cool it with fluids, you're disrupting your digestive system. You are diluting your stomach acid out with the liquid so it can't digest as optimally. So you really don't want to drink during meals, or just very little, just sips here and there. And you don't want to drink cold things. So that's another thing Americans are big on, is ice. It's not so much so in Europe. I don't know about other parts, but that coldness is going to kind of stop the digestion process. So you should be well hydrated. You should drink plenty of fluids, but don't do it while you're eating. Do it in between meals, and then just small sips while you're eating, so that way it doesn't disrupt your digestion. So that's the other thing, is liquids. And then another big rule is to chew your food thoroughly. If you are in a rush and you're just like chomping your food down in big chunks, your body has to break that all down. So the goal is to chew. There's not really a set number. It depends what you're eating, but to chew until your bites are liquid and then swallow. Because if it's already in a liquid setting, your body's going to absorb that much better. It doesn't have to break it down. So you want your body to work the least amount it has to, because your body's already working, guys. If you've got Lyme disease, your body's working like crazy. So anything that you can do to make things easier on your system, to make it so you can absorb as many nutrients and vitamins, do the simple things. Get back to the basics. It's going to really save you in the long term. It's going to have you get to results quicker and maybe need less supplements and other things if you are just really focusing on the basics, the everyday life habits that you do. So let's see, we talked about being mindful. We talked about sitting down and slowing down. So slowing your thoughts down, focusing on your food. Maybe you even try a mindfulness eating activity where you actually really look at your food and smell it and maybe even feel it and eat it slowly, chew it thoroughly. Think about how it is turning into you. At some point, it's not food anymore. It's your body, your cells. So you're extracting those nutrients. It's turning into you, and just be thankful for that. And so just slow down, be mindful, so your body can be in that parasympathetic state so that it can digest, so that you can absorb. Anything that you can do to help your body, the simpler it is, the better. We don't need something fancy. You're probably on 50 supplements already. So just concentrate on what you're doing in the day-to-day, and it can make a really big difference. And yeah, it takes about 20 minutes for the brain to know that the stomach is full. So if you're scarfing down food, there's a chance you're going to overeat, which some of you might have issues with that. Other of you might have issues needing to gain weight. So everybody's in a different place. Smoothies are a good option if you do have absorption issues. If you're drinking things that are already in liquid form, your body's going to be able to absorb those better. And if you are trying to put on weight, you might be able to add in some extra smoothies and get some extra calories in. I'm just seeing if there's anything else I wanted to say. Yeah, if you can concentrate on savoring your food, breathing, relaxing. And one tip that I have is I actually eat less often so that I can fully concentrate when I do eat. So, and it changes. Like when I was going through Lyme disease, I had to eat all the time. If I didn't eat like every 2 hours, I would crash and my blood sugar would be super low and I would be like a zombie and I would feel weird and I couldn't focus. So it definitely, like fasting isn't for everybody. It depends where you're at in your journey and what's going on. But for me, I like to eat twice a day only, so that way I can save time by not having to make and eat food more often throughout the day, but also then I can really focus on my food. So I wait till I'm really good and hungry and focus fully on my meal and eat it slowly and pay attention. And then I'm just doing it twice a day. So it just kind of becomes a ritual and a habit and something that just helps me, digest, helps my body absorb and digest the way it's supposed to. So I hope those tips were helpful for you. And if there are any rituals that you have around food, maybe it's saying grace, taking a moment for gratitude before your meal. That could be something that could just help you kind of get into the parasympathetic state as well. Whatever it is for you, I'd like to hear your comments on what rituals you have around eating and any eating hygiene tips that you have that seem to work well for you. So I hope you have a wonderful day.